Miscarriage is an emotionally painful experience that affects many families. It's estimated that about 10 to 20% of known pregnancies end in miscarriage, though the actual percentage could be higher since many miscarriages occur before a woman even knows she's pregnant. In today's video, we'll dive deep into what miscarriage is, the types of miscarriage that can occur, and how to seek support after such an event. Let's first explore what a miscarriage is, its potential causes, and signs to watch for. What is a miscarriage? A miscarriage is the spontaneous loss of a pregnancy before the 20th week. While it is a natural occurrence, it is a deeply personal and emotional event for those going through it. There are many factors that can cause or contribute to miscarriage. In most cases, the cause is unknown, but often it's due to chromosomal abnormalities in the embryo, making it unable to develop properly. Other causes include maternal health issues like uncontrolled diabetes, hormonal imbalances, infections, or issues with the uterus or cervix. Lifestyle factors like smoking, excessive alcohol consumption, or drug use can also increase the risk. Let's move on to the signs of miscarriage. The most common symptoms include vaginal bleeding, cramping, and the passing of tissue. However, these symptoms do not always mean miscarriage. Some women experience spotting and cramping in normal pregnancies. If you experience these symptoms, it's essential to contact your healthcare provider immediately. Types of miscarriage. There are several types of miscarriage, each with its own characteristics. Let's go through them in detail. Threatened miscarriage. A threatened miscarriage occurs when a woman experiences symptoms like vaginal bleeding or abdominal pain, but the cervix remains closed, and the pregnancy may still continue. It's called threatened because while these symptoms are concerning, they don't always lead to a miscarriage. Rest and medical monitoring are often recommended to give the pregnancy the best chance of continuing. Inevitable miscarriage. An inevitable miscarriage happens when the cervix begins to open, and vaginal bleeding becomes heavier. Unfortunately, at this stage, the pregnancy cannot continue. The opening of the cervix indicates that the body is preparing to pass the pregnancy tissue, and miscarriage is unavoidable. Incomplete miscarriage. In an incomplete miscarriage, some of the pregnancy tissue is expelled from the uterus, but some remains inside. This may result in ongoing bleeding or cramping. Medical treatment is often necessary to remove the remaining tissue, either through medication or a procedure known as dilation and curettage, or D&C. Complete miscarriage. In contrast, a complete miscarriage occurs when all the pregnancy tissue has been expelled from the uterus. While no further medical treatment is usually needed, follow-up care with a healthcare provider is essential to ensure that the miscarriage is complete and the woman's health is stable. Missed miscarriage. A missed miscarriage is often one of the most emotionally difficult types. In this case, the embryo or fetus has stopped developing, but the body has not yet recognized the pregnancy loss. There are typically no symptoms, and it is often discovered during a routine ultrasound when no heartbeat is detected. Medical or surgical intervention is needed to manage the loss. Recurrent miscarriage. Recurrent miscarriage is defined as having 3 or more miscarriages in a row. This is less common and often leads to extensive medical evaluation. Possible causes of recurrent miscarriage include genetic issues, uterine abnormalities, or autoimmune disorders. If you've experienced recurrent miscarriage, seeking specialized care may help determine the underlying cause. What happens after a miscarriage? After a miscarriage, physical recovery can take a few weeks, but emotional healing may take much longer. The support of family, friends, or a therapist can be incredibly valuable during this time. Physically, it's important to follow your doctor's advice, which may include resting and avoiding strenuous activities. In some cases, after a miscarriage, a woman may need a D&C to remove any remaining tissue to prevent infection. The doctor will also likely advise waiting for a few cycles before trying to conceive again, to give the body time to heal. Coping with loss. Coping with the emotional impact of miscarriage can be extremely challenging. Everyone experiences grief differently, and it's essential to give yourself the time and space to mourn. Miscarriage is often a silent grief, but you don't have to go through it alone. Many find solace in joining support groups or speaking with a counselor who specializes in pregnancy loss. Remember, miscarriage is not your fault. It is a natural occurrence, and in most cases, nothing could have been done to prevent it. Talking about your experience with others who have gone through similar situations can offer comfort and reduce feelings of isolation. Seeking medical support. It's important to seek medical advice if you've experienced a miscarriage. Your doctor will evaluate your health and may suggest testing to determine the cause, especially if you've had recurrent miscarriages. Tests may include blood work, genetic tests, and ultrasound examinations of the uterus. Moving forward after miscarriage. Moving forward after a miscarriage is a deeply personal journey. For some, the hope of trying again brings comfort, while others may need more time to heal emotionally before considering another pregnancy. It's important to follow your heart and listen to your body as you decide what's best for you. Some couples may seek fertility counseling or explore other options like adoption. Whatever your path may be, know that you are not alone in this experience. Miscarriage is more common than most people realize, and support is available to help you heal and move forward. Thank you for watching. We hope this video has helped you better understand miscarriage and the types that can occur. Remember, support is always available. If you or someone you love has experienced a miscarriage, reach out to healthcare professionals or support groups to help guide you through this difficult time. If you found this video helpful, please like, subscribe, and share for more health-related content.